Very much, Mr. Chairman, and I want to thank you, Mr. Chairman and Ranking Member Eshe, for having this hearing today, and I want to thank the witnesses for being here today. I'm excited to see my bill, the Access to Prescription Digital Therapeutics Act, noticed in today's hearing. This bill is critical to ensuring Medicare and Medicaid beneficiaries receive equitable access to innovative mental health treatments. I hope my colleagues will join me in pushing for this critical bipartisan bill in a markup soon. Prescription Digital Therapeutics, also known as PDTs, are software-based treatments designed to directly treat a disease. PDTs are tested and approved by the FDA, much like traditional prescription drugs. They are prescribed by healthcare providers to treat a wide range of mental health issues, including PTSD, insomnia, anxiety, and depression. Patients deserve a timely access to the treatment that works best for them, yet access to PDTs is hindered by the lack of Medicare coverage. That's why I'm co-leading the Access and Prescription Drug Therapeutics Act that would expand Medicare and Medicaid coverage to include PDTs. Dr. Hughes, how might digital therapeutics help bridge the gap for mental health services among Medicare beneficiaries, especially among underserved populations?
Thank you, and thank you for the question. As you may know, behavioral health is one of our key priorities at CMS, and providing access in underserved populations, especially within that. We recognize the potential for PDTs to address some of the access and care needs of our beneficiaries. We're mindful that FDA has approved at least a couple of applications. We have asked questions in our recent proposed payment rule. We're reviewing those comments, and we hope to have more information shortly for you and the others interested parties on this issue.
Yeah, I realize that, but what does CMS see as the next steps for incorporating digital therapeutics as an existing benefit?
Yes, and that is part of what we ask questions in our proposed rule. We also are looking in terms of thinking about the benefit categories. There's also coding and payment issues. I'm not from the Center of Medicare, but certainly I'd be happy to take these questions back and provide more details, more detailed information if that would be helpful.
Okay, yes, it would. Thank you very much. I want to briefly turn to rare diseases. Dr. Hughes, your testimony focused on CMS's work to streamline coverage for innovative treatments and technologies. However, in the case of rare diseases, existing treatments may have promise if repurposed for additional indications beyond their approved use. Yet, off-label treatments remain out of reach for Medicare patients. Congress acted to address this issue for cancer patients who face the same issue. Dr. Hughes, how did the change to allow Medicare coverage for off-label cancer drugs, if included in certain compendia, impact cancer care?
Thank you for that question. As you know, we don't interfere or direct the decision-making by doctors. It's between doctors and their patients. We know that Congress developed the compendia proposal that's used in many settings. To the extent that it's improved quality or access, I haven't seen the evidence on that, but I would love to get back to you with the information that we have likely within the Center of Medicare.
Okay, well, thank you very much. I'd like to work with you on this committee to explore a similar solution for rare disease also. So that's the end of my questions. I yield back, Mr. Chairman. Thank you.
Thank you. The gentlelady yields.